Assalamualaikum warahmatullahi wabarakatuh, and very good morning to my lecturer, Dr. Fiza, and my fellow friend. So today I would like to discuss or explain about the topic can asthma cause death. So according to the Center for Disease Control and Prevention, CDC, approximately 25 million Americans has asthma. So the most common chronic condition among American children is about 1 out of every 12 children has asthma. So now we have to know what is asthma, because if we know what is asthma, we can prevent, or we can know the condition, what is it. So what is asthma? Asthma is a condition where our airways narrow and swell. It also may produce extra mucus. So, based on the diagram, we can see that there are three conditions of our airway. First is a normal airway lining. So second is the lining was inflamed and the muscle was tightened. And the last one is also same that second condition, but with extra mucus at the lining airways. Okay. Now we move to the symptom that we know we have asthma. Okay, first is coughing, especially when night. Then laughing or during exercise. Second, tightness of in the chest because we hard to breathe. The next, shortness of breath. So because the tightness in the chest, our breath will short. So next, difficulty to talk or to speak. So because the oxygen in our body was low. And the last one is fatigue. So fatigue is related to our lung, because when our lung did not accept oxygen or accept low oxygen, we make our body fatigue and our muscle fatigue. That will make we can do our daily routine easily. So next we move to diagnose. So how to diagnose the asthma patient or asthma sufferer? There are three ways to diagnose. First is health history. Second is physical exam, and the third one is a breathing test. So what is health history? So health history, that we ask the patient, or the doctor ask the patient whether he has or she has a family that has asthma or the other cardiovascular disease. So with that, if the family has asthma, so we can conclude that she or he probably has asthma because of family background and genetic. Because the asthma also can produced by genetic. If your mother or your father have asthma, so we also can have asthma. Like me, my mother have asthma, so I also have asthma, but my asthma is not too heavy. I can do exercise or playing sport. So the second one is a physical exam. So the physical exam, the doctor will listen our heartbeat or our lung using a stethoscope to know our lung condition and our breathing condition. So then also in physical exam, the doctor will do a skin test to detect our allergic, because allergic can make our body high risk to get asthma. So the last one is breathing test. So breathing test, we use pulmonary function test. Pulmonary function test. Okay. The pulmonary function test, they can measure our airflow from the lung to know our asthma. So from the diagram, we know the patient have to blow their air from the lung to the pulmonary function test to know their level of asthma. So now we jump to the result. So based on the study, at 87 patient was tested. Only one from them died because of asthma attack. The rest of them because another disease like malignant disease. So from this chart, we know that asthma only 1.9% that can cause that. There are another causes from malignant disease. There are 31 patient that was list dead, which is 57.4%, and the second is lung cancer. 10 patient was died, which is 18.6%. So from this study, we know that asthma can cause death, but it's a minor majority. So we can look easy for the asthma, that we have to take care of it, or if you have a symptom, you have to go to the hospital or clinic to check and get a treatment. So the last word from me, take care of your health and be healthy. Thank you.